Yeah, and me.
Okay.
Hutchinson-Gilford progeria syndrome is a rare fatal genetic condition characterized by an appearance of accelerated aging in children. Its name is derived from the Greek and means prematurely old. The syndrome was named after two doctors, Jonathan Hutchinson and Hastings Gilford. The two doctors shared their discovery and agreed on naming the syndrome Hutchinson-Gilford progeria syndrome. Children appear normal at birth, but signs and symptoms appear around 12 months of age. Life expectancy is 13 years old, but some live until 20. My speech will include the signs, symptoms, causes, treatments, and how the syndrome affects a child's life. Progeria has reported incidences in about 1 in 4 to 8 million newborns. Race and gender are reported to be equal in newborns that have been diagnosed with progeria. Between 10 to 24 months of age is when parents may suspect something is not right with their children. Main symptoms include slow growth and age-looking skin, a narrow face, and beaked nose. Another symptom is hair loss and few to no eyelashes and eyebrows. Parents may also conclude something may be wrong with their child who has a larger face, thin lips, or visible veins. As they get older, more symptoms make this syndrome very noticeable, including high-pitched voice, major weight loss, stiff joints, hip dislocation, and the most dangerous symptom being irregular heartbeat. A heart problem is the cause of death in most children who suffer from progeria. Progeria is caused by a mutation in the gene called lamina. The lamina gene produces the lamina A protein, which is the structural scaffolding that holds the nucleus of a cell together. Researchers now believe that the defective lamina A protein makes the nucleus unstable. That cellular instability leads to the disease process in progeria. In October 2002 and April 2003, leading scientists who have been studying this rare gene were able to isolate the progeria gene. Isolating the progeria gene is a major achievement for the medical research community. The discovery not only gives hope to children and families affected by progeria, but also may shed light on the phenomenon of aging and cardiovascular disease. Progeria is usually not passed down in families, however, but 1 in 400 million births can have history of the syndrome. A genetic test of the mutation of genes will confirm the diagnosis of progeria. Unfortunately, there has not been a cure found for this terrible syndrome. Since children that suffer with progeria have an irregular heartbeat, it is advised to monitor the child's heart by making regular visits to the doctor. Many children who have been diagnosed have coronary artery bypass surgery. Surgery will help slow the diagnosis of cardiovascular disease. Although progeria does not have a cure, there are steps to take in delaying the progressive of the syndrome. According to Mayo Clinic staff, doctors have been encouraging many to take a low-dose aspirin daily to help prevent heart attacks and strokes. Some medications that help with lowering cholesterol and preventing blood clots may be prescribed to the child. With height and weight being complications, growth hormones may also be taken. Since hip dislocation and stiffness of the joints are also complications, physical or occupational therapy may help with the comfort. As I have mentioned, an individual matures and grows much faster, and regular dental exams are recommended. Permanent teeth push out the baby teeth faster than a normal person, which will result in crowded teeth and deformity of the jaw. Extraction of the teeth is important because a second row of teeth may form without the baby teeth completely falling out. Children who have been diagnosed with progeria have a different life than other children. Even though they are kids at heart, their body is as old as an elderly person, and many have health problems. Children with the syndrome get many stares and questions because they do not look normal. I'm glad I chose this topic to research. I was being told about a syndrome where children only live to be between the ages of 13 and their early 20s. I've worked in the healthcare field for almost 4 years and have never heard of progeria. I think the syndrome is very interesting and is unbelievable that the body is able to age 8 times faster than the normal body. By doing this research, I gained a lot of knowledge and enjoy sharing the information that I learn with people that I know. Along with myself, those that I share information about progeria have never heard of it.